Hi, my name is Samantha Perry. I'm an HPA major and a senior at Penn State Mont Alto this year. I chose to do the topic of electronic health records that's dealing with patient safety and patient satisfaction. A few things that I want to be able to take away from this today would be what an EHR is if you don't already know what that is, how EHRs eliminate medical errors, how patient outcomes, safety, and access deals with EHRs, and how EHRs enhance workflow, diagnoses, and medical procedures. I chose to research EHRs because with health information technology, patients will not be getting the quality care that they deserve. EHRs enhance our quality of care as well as our access to care. I have heard a lot of stories about folks who did not have their medical records that were in a medical emergency situation who had come close to death. I believe that everyone should have access to their medical records whenever they need them. Plus, EHRs have given providers access to patient records and better treatment for patients. Without EHRs, our healthcare system would not be as advanced and our healthcare system would not provide the best care for our patients. Okay, so the next source that I chose to do was through Health IT. Some things that we're going to pull from that would be how EHRs improve health, patient participation, care coordination, diagnostics, patient outcomes, and how EHRs induce efficiency and are cost savers. So for many years, research has shown that EHRs have benefited our healthcare system. According to Health IT, EHRs have improved care, patient participation, care coordination, diagnostics, patient outcomes, and induces efficiency and cost savings. This source analyzes each aspect listed above and explains how this health information technology is such an asset to our healthcare network. It has improved care for patients by not having to fill out the same paperwork every time to come into the doctor's office, and has given them access to perks such as getting their medication sent electronically to the pharmacy. Also stated in the convenience for the patient to interact with a provider electronically, which may include getting a referral for a special care appointment. This also benefits the provider because it gives them quick access to patient files, which in return supports decision making, informs them of important medical information, interfaces with labs and other EHRs, which also is safer and more reliable for prescribing medications. All in all, EHRs improve availability to patients and providers of patient information while being convenient and safer at the same time. Another main point that this source points out is the cost savings and medical practice efficiencies that EHRs provide. A few costs that they have reduced are transcription costs and pooling, storage, and refiling of paper medical charts. Along with cost savings, EHRs have reduced medical errors and improved healthcare practice management systems that deal with scheduling, coding, claims, insurances, and etc. These health information systems have enhanced our workforce for the better and have been saving us time and money. In healthcare, to have a patient participate in their healthcare through EHRs and other healthcare technology is beneficial to the patient and their provider. Health IT describes different advantages of patients being interactive with their access that they have to their health information, as well as access for collaboration between them and their providers. As a patient, using EHRs ensures high quality because it gives them full and accurate information about their medical history. It also encompasses an avenue for patients to stay connected through quick and easy communication systems like a patient portal. Technology is being more prevalent in healthcare, and we need to take advantage of what is given to make sure that we are receiving the best care that we can get. The next source that I looked at was applied clinical informatics. This research focused on enhancing patient safety, enhancing workflows, policy and practices, and the PPPSA, which I will describe here shortly. The applied clinical informatics researched the role of EHRs in enhancing patient safety. They also examined how early EHR adopters in primary care understood the extent to which EHR implementation is associated with workflows, policy, and practices that promote patient safety are compared to practices with paper records. They did so by utilizing the physician practice patient safety assessment, which is the PPPSA, to compare the primary care offices with fully functional EHR systems to those who are still functioning with paper records. The PPPSA is a tool used to scope how individual physician practices measure safety and quality processes. This tool is specifically used to look at medication management, handoffs and transition, personal qualifications and competencies, practice management and culture, and patient communication, which are all measurements used in comparing the paper records to EHRs. Tanner C. et al. With the Applied Clinical Informatics did a study from 2006 to 2010 that focused on inpatient and ambulatory care with patient safety. They did an analysis of 219 primary care facilities, 117 offices operated on paper records, and 92 used an EHR. Results unveiled within all domains, EHR settings showed remarkably higher rates of having workflows, policies, medication management, and practices that promote patient safety rather than paper record settings. All of these domains represented that EHR systems are safer for the patient than paper records. It also is more beneficial for medical providers and provides efficiency that will provide safer for patient care and a safer work environment for the staff. Next, we are going to go to the AHRQ, which is the Agency for Healthcare Research and Quality. They focus their research on how EHRs can prevent care to patients, and then some statistics that were in there, about 17 to 30% of the places that use EHRs rather than paper records were safer for patients and the providers, and that EHRs prevent adverse events. So Helwig and Lomatin are members of the Agency for Healthcare Research and Quality, AHRQ. They conducted a research to see if electronic health records can prevent harm to patients. This was done in 2012 and 2013 and specifically looked at cardiovascular, pneumonia, and surgical patients whose treatment was fully under an EHR system. Data revealed that between 17 and 30% of the patients were less likely to experience in-hospital adverse events compared to hospitals that did not have a system that was fully electronic. AHRQ also looked into the question of, can EHRs go beyond improving safety-related processes to actually preventing adverse events, such as potentially deadly hospital-acquired infections from reaching patients? While investigating this question, Helwig and Lomatin found that EHRs provide better coordinated care from admission to discharge, and in return reduces the risk of harm reaching a patient. Most healthcare facilities have chosen specific EHR applications, and we continue to see the implementation of health quality and safety features. EHRs can play a key role in preventing adverse events, and as this study suggests, the adoption of EHRs can better manage the multiple tasks that prevent adverse events before they occur, keeping patients safer as a result. Next, I found a source that designed their own EHR that implemented the empowerment of patients and communications with their healthcare providers. This was the Journal of Medical Informatics, and they also are focusing on patient satisfaction and patient access. This was written by the International Journal of Medical Informatics and the Munster University Hospital, which implemented the EHR, which is called the Actina Online, which is another name in German for Medical Record Online. The goal of this EHR is to give citizens the possibility to be in charge of their own records electronically, to provide access to this record through the internet independent from place to place, to present personalized health information online, and to serve as a medium for sharing selected areas of health information with caregivers. For all of the references used above, I do not think that any of them had issues or problems that would need necessary attention. All references promoted and recommended using EHRs and relate that these systems enhance patient participation and enable patient safety. I think from the research and personal experience that EHRs have strengthened our healthcare system in multiple ways. I also think that this is extremely important for patients to stay connected with their providers and to have access to their medical records. Without EHRs, our healthcare system will be extremely behind compared to other countries. All in all, these health information systems enhance our workflows, diagnoses, eliminates medical errors, enhances patient outcomes, enhances patient safety, gives patients more access, and is better for their medical procedures and needs.